654 will create incentives to provide in-home health care for children with severe and complex long-term health needs through the Medi-Cal program at a fraction of the cost to the state. There are nearly 4,500 children statewide with catastrophic health needs that have been receiving care through expensive ICU-level hospitals that would greatly benefit from in-home skilled nursing. This bill will help to respond to barriers preventing accessible quality in-home nurse care for children. Out-of-date reimbursement models and difficulty recruiting qualified nurses for common Medi-Cal pay rates have resulted in longer hospital stays, frequent hospital readmissions, waiting lists, and even no access to in-home nursing care at all. Without the access to skilled in-home nursing, the state is unnecessarily spending limited resources and preventing children from being at home with their families. The Medi-Cal rate is significantly below what surrounding states pay and more than 50% below the average commercial rate, making it increasingly difficult to find affordable care for these families due to home health agencies not accepting Medi-Cal patients. Additionally, there are major decreases in agencies serving Medi-Cal patients, and out of those decreasing numbers, not all are able to provide the necessary hours. AB 68 in 2001 acknowledged a crisis caused by the reduction in the number of available home health agencies and enacted law to help combat that issue. 16 years later, we are still experiencing major shortages in available nurses. AB 654 will create an innovative program to increase payments to health home agencies if they can improve access and care for children, as well as ensure accountability by requiring a report to the legislature on the effectiveness of the program. Simply receiving the necessary medical attention these medically fragile children and their families deal with on a day-to-day basis, and they need from the comfort and care of their home at a minimal cost to the state, is the least we can do to help them out. Here to testify in support is Melanie Schlotterbeck on behalf of her family and Mira Morton with the California Children's Hospital Association.
My name is Melanie Schlotterbeck. Thank you for having me. I live in Orange County. My niece Kennedy has a terminal neuromuscular disease called spinal muscular atrophy type 1. It's the childhood version of ALS. I am here in support of AB 654 because my twin sister's family is in desperate need of nursing assistance. 90% of babies with this type of spinal muscular atrophy never reach their second birthday. Kennedy is now 7. This disease robs children of virtually all voluntary muscle movement. Kennedy can't eat, swallow, sit, hold her head up, cough, or even breathe on her own. While smart and sassy, she is essentially paralyzed and requires care 24 hours a day. Kennedy's Medi-Cal waiver authorizes 18 and a half hours of in-home nursing a day, but for the last 6 months, fewer than 5 hours a day have actually been filled. In addition to caring for Kennedy's needs throughout the day, my sister Jennifer spends her nights checking the feeding pump, the ventilator, the humidifier, listening for alarms, suctioning Kennedy, and turning her as many as 8 times a night. In 7 years, my sister has had fewer than 10 nights of uninterrupted sleep. Jennifer herself has worked those unfilled nursing hours day and night because there isn't enough nursing coverage. Jennifer and her husband have private health insurance, but like most private policies, it doesn't cover shift nursing care. Medi-Cal is their only option. Kennedy's nursing agency has been unable to attract nurses due to the low wages. My sister would be here in person to tell the story, but she didn't have nursing coverage to make the trip. There are 4,500 pediatric patients using in-home health nurses and even more on a waiting list. These children are our most vulnerable and our most fragile. We need your help to alleviate some of the strain, the risk, and the exhaustion their parents face every day and every night. The only other option to in-home nursing is to institutionalize these children at far greater cost to the state than keeping them at home with their families. AB 654 is an important step forward in improving access to quality nurses for these children. In March, Kennedy received the first injection of a new drug to help treat her disease. Kennedy, Jennifer, our mom, and I all dyed our hair hot pink, Kennedy's favorite color. We did this to honor the significance of the day, a day we never thought Kennedy would live to see. So it's with our hot pink superpower hair that my family and I urge you to support AB 654. Thank you.